Ms. Dingell for 5
Thank you,
minutes.
Mr. Chair, and thank you and Ranking Member DeGette for holding this important and very timely hearing. It's coming at a pivotal moment. Millions of Americans across the nation have seen their health care premiums skyrocket because of both the expiration of the Affordable Care Tax Credits last month, the only thing that made a lot of people able to afford it, but also because of the passage, I'll behave today and just call it the big brutal bill. Insurances sent out renewal notices a couple months ago notifying consumers that their premiums were going to skyrocket in 2026. Yet, all of you are posting record profits, approving millions of dollars worth of CEO compensation packages, executive bonuses, and paying your shareholders. Let me tell you something. People are really struggling. I hear the stories every single day. The moms are the worst. They're not able to get their kids their medicine. Even parents with asthma, their children have asthma, can't afford the inhalers. Make no mistake that we're seeing a ripple effect. My colleague next to me just talked about some of them that are going on. The American people deserve better. I want to start with Ms. Allen. I want to thank you for being here today and for your willingness to be one of the faces that is sharing your personal story. It's important for everybody in this country, but especially the executives at this table, to understand directly from real people living with the consequences of both what happens here in Congress and what happens in the insurance companies. Like nearly 200 million Americans, Ms. Allen is living with a chronic health condition that makes consistent and affordable coverage important. Ms. Allen, I know you had no choice but to buy the bronze plan on the Affordable Care Marketplace. You wanted to buy the silver, but you couldn't afford it. Can you explain what that means in real terms?
Thank you for the question so very much. Yes, I was hoping to purchase the silver plan just to reduce my total out-of-pocket costs. I mean, 40% coinsurance, the out-of-pocket cost. I knew I would face $10,000 potentially, and actually likely. So that's money that I actually took out of a savings account to pay my health care costs. And I'm closer to retirement, right, than not. So that is not helping me secure my economic viability in my retirement years.
May I ask you one more question and then move to the others? But your affordable care plan that you have, it's worked, right? How many claims have been denied?
I've had essentially no claims denied with my plan. I've been very happy with my plan, particularly with the tax credits.
Until this year, correct?
Until this year. I think I've had one specialty eye drop medication denied, which eventually I was able to secure.
Now I'd like to turn to Mr. Hemsley, who is the CEO of the country's largest insurer. A CBS News analysis of about 1.3 billion federal health insurance claims across 3 years shows that in 2024, insurers denied 19% of in-network claims, about 1 in 5. UnitedHealth in particular denied as many as 1/3 of its federal claims in the preceding 2 years, all while raking in record profits of $400 billion. Patients who are battling terminal illnesses are spending the last days and months of their lives with loved ones on the phones battling with their insurance company, and essential treatments are being denied. Mr. Hemsley, should sick patients who don't want to leave their families with bills have to spend hours on end fighting to get their treatments approved?
Congressman, thank you for the question. It is very important that people don't go through that kind of complexity and that.
So how are you simplifying it? Because I don't have a lot of time.
So I would love to comment on that. Really only about less than 2% of all the interactions that we receive are under a prior authorization review. And the vast majority of those are administrative. And at the end of the day, 99% of all the care is covered. We should be doing more to expedite and make the prior authorization processes quick, real-time, accurate, crisp, and not interfere with care.
So are you telling me the fact that 1/3 is denied is not true?
It's not consistent with our experience at all.
I have more questions for the record. Thank you, Mr. Chair, and I'll yield back.
Gentlelady yields back. Now recognize